Hello, Facebook friends. Let me take time to welcome you to Get Healthy with Dr. Cooper, a program designed to educate and inspire you so you can take charge of your health and live a happier, longer, and more fulfilled life. You know, last month we spent time discussing breast cancer, risk factors, prevention, and how to use lifestyle to prevent this cancer from recurring. And this month, the focus will be on men's health. So I hope today our brothers and all the men are there listening. And I'd like the wives and the mothers and the sisters to share this video with all the men you know. But before we go into a program, I'm not sure if our national community as well as our global community heard what happened in Texas today. There was a mass shooting and several people lost their lives. So I'm going to ask you to pray for the families that lost their loved ones this morning. So let's talk about prostate cancer. This month we will be looking at prostate cancer, erectile dysfunction, testicular cancer. You know, a lot of times we spend more time discussing women's health over men's health. So this month is dedicated to men's health. And what do you know about prostate cancer? I know the C word is always a word that no one wants to hear, cancer. Cancer sometimes indicate fear and stress and is this my last few months on earth? So I want to educate you in prostate cancer. Prostate cancer is very common in men. It is probably second to skin cancer or to lung cancer. It is believed that 1 in 7 men will be diagnosed with prostate cancer. Worldwide, 1.1 million men are diagnosed yearly with prostate cancer. And 300,000 of those men die from the cancer. In the United States, it's estimated that this year, 163,360 men will be diagnosed with prostate cancer. You might be asking, am I one of those men? Will I be diagnosed? What are the risk factors for prostate cancer? So let's look at risk factors. And we'll start with race. Now, it is believed that African American men have a 70% higher risk than non-Hispanic whites in getting prostate cancer. So if you're listening to me and you're African American, you need to pay special attention. And of course, age. The risk of developing prostate cancer increases with age. So from age 50 and above, then the rate of prostate cancer is higher. Now, prostate cancer can be seen in men below age 40, but not many men. Maybe 1 in 10,000 men below the age of 40 will be diagnosed with prostate cancer. Other risk factors are, as I say, genetics. Genetic is, and you know, if you listen to the program, you will hear many times we talk about genetics. Genetics usually load the gun, but lifestyle pulls the trigger. So if you're a man and your father or brother or a cousin was diagnosed with prostate cancer, then your risk, just having a first-degree relative, your risk will be increased by 2.5 times. So genetic is a big risk factor. However, as we have listened nowadays, you probably have heard about epigenetics. You can tweak your genes by living a healthy lifestyle. So if you feed your body healthy nutrients and if you exercise, then you can probably delay the onset or those genes might not be expressed. So if you have a family member with prostate cancer, then you should start thinking seriously about getting checked. Now, at what time do we check the men? Then usually age 45 and above, the man should have a yearly prostate evaluation. And I will discuss that as I get further down into the lecture. Lifestyle. Now, you probably have heard much about lifestyle modification. Now, a diet that is high in saturated fat places you, the man, at a higher risk of getting prostate cancer. Obesity as well is a risk factor for prostate cancer. The use of testosterone, some men like to ask for injection for erectile dysfunction, but the prolonged use of testosterone therapy could also increase the risk for prostate cancer. Now, usually when we talk about prostate cancer, if a patient comes into me with prostate cancer, then I'll try to educate the patient on prostate cancer. It's not one of those cancer with a rapid aggressive growth. So there are various stages of prostate cancer, various types of prostate cancer, and therefore the treatment for prostate cancer varies depending on the size, on the type. Now, you might be wondering, what is the prostate? Where is the prostate? As a man, you probably know more about the testicles and the function of the testicles, but the prostate is a very small gland that is below the bladder. And you might be wondering, so what's the function of that gland? Now, the prostate has many functions. But before I go into the function, I have a video to show you on prostate cancer. It's going to last about 2 minutes. Let's go over to the video so that if you're watching this, you can actually see the anatomy of the prostate and the man's urinary tract. So let's run the video on the prostate.
Prostate cancer is the most common form of cancer in men. Approximately 80% of men above the age of 70 have prostate cancer. Many men live an entire life without any knowledge of its presence. The prostate gland is located in front of the rectum and below the bladder. The upper part of the urethra passes through the prostate. Here we see normal urination. The main function of the prostate is to produce a secretion. This secretion forms a part of the seminal fluid and is essential to the survival and mobility of the sperm. During sexual stimulation, the prostate and seminal vesicles produces secretions. The urethra contracts at the bladder and the corpus cavernosa of the penis swells. Simultaneously, sperm is produced in the testicles and gathers in the epididymis where it is matured. From here, the sperm is transported to the prostate via the vas deferens, through the seminal vesicle, and into the prostate gland. The sperm and prostatic secretions compound before they are ejaculated. Prostate-specific antigen, also known as PSA, is produced in the prostate. Both benign and malignant growth of the prostate can exert pressure on and destroy the glandular tissue. This can lead to an increased leakage of PSA into the bloodstream. A high PSA value in the blood is currently the most common indicator of prostate cancer. Most tumours begin to form in proximity to the outer surfaces of the prostate gland. In most instances, the tumour is slow growing and symptom-free and will remain confined within the prostate gland. Some tumours can grow to a volume where they begin to obstruct urination. Other tumours can grow in a way that exposes them to palpation via the rectum. Aggressive tumours can eventually breach the capsule and infiltrate nearby organs. As with all living tissues in the body, cancer also needs a supply of blood to survive. If tumour cells separate and enter the bloodstream, prostate cancer may spread to other parts of the body.
Men, the prostate is a gland you do not want to lose. But prostate cancer, one of the treatments for prostate cancer is removal of the prostate gland. So let's talk a little bit in terms of the function of the gland and why is it that you should protect your prostate. So if you're listening to me, men, I want you to share this video, and ladies, do the same thing. because you want your husband and your brothers, your father, to maintain that prostate, because it is very important in their sexual function. So one of the functions for the prostate, you might have heard it just now on the video, is to provide seminal fluid. This fluid will nourish and protect the sperm during ejaculation. Prostate also is helpful in fertility. The prostate produces prostate-specific antigen, which allow the sperms to swim into the uterus by keeping the seminal liquidity. The PSA, which is the prostate-specific antigen, counteracts the clotting agent in this fluid and therefore allows the sperm to float. The prostate is a pump. It pumps the seminal fluid through the penis, and which therefore allows the sperm to get to the vagina. The prostate also helps sexual satisfaction because it's a pump. The pumping action gives the feeling of pleasure. So you want to take care of your prostate in order for you to enjoy your sexuality. Now, stimulation of the prostate can produce an exceptional strong sexual response and intense orgasm. So stimulation of the prostate is also helpful to produce a great orgasm. The prostate helps in erection. Prostate has nerves, and when the blood flows through the prostate, these nerves are stimulated, and they trigger the penis to swell and become hardened, and therefore to sustain an erection. The prostate also, because it sits below the bladder, it acts as a valve, and therefore it can allow the urine to flow from the bladder or suppress the flow of urine from the bladder. Another very important function of the prostate is that the prostate helps to regulate testosterone. Now, in the prostate, there is a substance that is called, it's an enzyme, alpha reductase. This enzyme converts testosterone to dihydrotestosterone, which we call DHT. This DHT is 10 times more powerful than the simple testosterone. So this will increase the man's sexual drive and function. Now, do you see why you have to protect your prostate? The prostate is important for sexual pleasure. It's important to maintain the health and the mobility of the sperm. The prostate is helpful in fertility. Now, what are some of the common problems of the prostate? Now, you might be out there listening and you're wondering if you have a prostate problem. Now, the prostate can become enlarged with age. We call this BPH, or benign prostatic hypertrophy. So if your doctor tells you that the prostate is enlarged, do not get anxious that you're having prostate cancer. It's a normal process in an aging male. Now, what are the symptoms of an enlarged prostate? Well, one is the urine stream might become weak. That's one. The man might want to urinate more frequently, especially during the night. There is also hesitancy to flow, so you might have difficulty initiating the urine or difficulty stopping the urine. These are signs of prostate enlargement. Also, the prostate can become inflamed or infected. This will cause pain. This is called prostatitis. We treat that with antibiotics. And of course, the cancer of the prostate. Now, most time, cancer of the prostate will not initiate any symptoms or sign. The person might just have this flow problem, decreased flow, getting up at night to urinate. These are just signs and symptoms. So if you're listening to me and you're having any of this, make sure you go and see your physician so that you can be evaluated for prostate problem. All right. Now, when we speak about cancer, now cancer is a abnormal growth of cells, and sometimes these cells are moving out of place into distant glands, and then we say that the patient have metastasis. Now, usually with the prostate cancer, and if you put up my slides on the anatomy of the prostate, I can explain this section a little easier. So here we have the prostate. We have the bladder at the top. You can see the bladder. Below the bladder, we have the prostate, which is a walnut-sized gland, a very small gland. And then through that gland past the urethra, that is the tube that takes the urine from the bladder into the to the penis and to the exterior. Then we have the penis that is there. So then, because the prostate sits under the bladder and through the prostate runs the urethra, then if the prostate is enlarged, then there's a decrease in the flow of the urine. So the patient will have difficulty with flow. So if you're listening to me and you're having a weak stream, urinary stream, or if you have to go a lot to the bathroom at nights, or if you're having some urinary incontinence, then you need to see your doctor to be checked. These are obstructive signs. Now, sometimes when the cancers develop, let's move to the next slide. The cancer usually develop at the surface of the prostate. And therefore, one of the ways in which the doctor will try to detect that cancer is through a digital rectal examination. So men 45 and above, if you go to the doctor and the doctor says, I need to do a rectal exam, do not hesitate, because the prostate is anterior to the rectum, it's very easy for us to palpate the prostate and palpate a growth going through the rectum. So there we can see the development of a tumor. It's very obvious. Now, as I mentioned before, that usually with prostate cancer, the growth of the tumor is slow, very slow growth. So a lot of time, if the patient is diagnosed with prostate cancer, there are different manner of treatment. One is watch and wait, because the growth sometimes take 20 to 30 years for that growth to become problematic. So usually if a patient is 70 or 80 and they're diagnosed with a cancer that is contained in the prostate, we might recommend watch and wait, no surgery. Okay? If the patient is younger and therefore the patient has many more years to live, then there are various treatments that can be recommended. Treatments are like surgical removal of the prostate, chemotherapy, hormone therapy, and radiation therapy, depending on the stage of the cancer. Now, most time, the cancer is diagnosed at an early stage, and then treatment option and result is favorable. Most prostate cancer, 92%, are found when the cancer is contained. Therefore, the nearby organs are free of the cancer. These patients have a low mortality rate. That means the rate of survival is excellent. Now, if the cancer is diagnosed late, when there is distant spreading of the cancer, then the mortality rate will drop to about 29% for 5 years. As I mentioned before, that there are not many warning signs and symptoms for prostate cancer. I mentioned the flow problem. However, if the cancer is advanced, that means if it were not diagnosed early, then the patient might present with low back pain, pelvic pain, bone pain. And this will indicate that the cancer is advanced, and therefore aggressive treatment will be needed. So if you're listening to me and you're having any signs and symptoms that I'm discussing, then make sure you see your doctor. Now, how do we screen for prostate cancer? Now, if you're younger than 40 or 45, and if you've not had a physical, go ahead, get your physical. If you're 45 and above, you also need a physical, and when you get there, then you need ask your doctor to do prostate screening, prostate cancer screening. This is done two ways. One is the digital rectal exam. The doctor will insert the finger into the rectum. The doctor will move forward with that finger to palpate the prostate. What are we palpating for? We're palpating for the shape and the texture of the prostate, see if we find any indication of nodule or tumor. If a tumor is found, then a biopsy is indicated. The other way to screen for prostate cancer is by doing a blood test. Prostate-specific antigen level is done by a blood test. Even though there are many schools of thought wondering whether or not the prostate-specific antigen is really reliable, but that's what we have been using for years. And if you're 45 and above, you need to make sure your doctor has a baseline level. And this needs to be repeated yearly. So if your base was, say, 1, and then next year it's 2, then that will indicate that there's possibility of enlarged prostate. Enlarged prostate will increase this level, or you probably are developing cancer. So men, if you're listening to me, remember that the prostate is a gland that you want to maintain for life because of all the functions of the prostate. So you need to protect yourself from losing that gland. When you lose that gland, you're going to be losing your testosterone level. You're going to be losing the control of the bladder. So a lot of time post-surgically, the man might have some form of urinary incontinence. The man might not be able to have an erection. So you want to make sure that you protect yourself from prostate cancer. You know, the main focus of my program is not necessarily to treat diseases. I want to empower you to change the way you're living, and therefore protect yourself from getting diagnosed with diseases that are preventable. And I discussed earlier on that there's some risk factors for prostate cancers that are modifiable. And I'm going to be going over them with you for you to start thinking, hey, what do I need to do to ensure that I do not have prostate cancer, whether now or tomorrow? Or if you're a woman, you're listening to me, how can you help the men in your circle of influence to stay healthy and to maintain health of prostate? Well, let's look at the risk factors again. Remember that genetic will place the man at 2.5 risk, 2.5 times of getting prostate cancer. So if the father or the brother or the son was diagnosed with prostate cancer, it will place the other male in the family at a risk 2.5 times higher than the general population. So if you know that you have a family history of prostate cancer, then seek medical advice now. However, there are many things you can do to prostate-proof your lifestyle, which I'll discuss later. all right? And men, if you're 45 and above, then you need to make sure you go for screening. Now, let's look at lifestyle modification. Obesity or overweight, a BMI of more than 30 will place the person at risk for many diseases, including prostate cancer. So if you are overweight, you need to make change in your lifestyle. You need to try to attain a healthier weight. Healthier weight will protect you from getting prostate cancer and other diseases such as diabetes, hypertension, if you're a woman listening to me, breast cancer, endometrial cancer, and so forth. Many studies have shown that men with higher grade cancer, more aggressive cancers, cancer that grow faster, or cancer that return after surgery are obese. So obesity places you at risk for having cancer, for having more aggressive cancer, for your cancer to return after surgery. So it is very important for you to work on attaining a healthier weight. Now, patients who are obese tend to have insulin resistance. So the pancreas secretes more insulin than usual. Now, insulin will produce an insulin-like growth factor, which will cause cancer formation. Also, it is believed that obese patients have more inflammatory processes that will affect the cell DNA, will cause DNA damage. This will lead to mutation and cancer formation. So obesity is a state that you don't want to see yourself at because of the multiple risks of having many, many diseases. Also, a diet that is low in vegetables will increase your risk of cancer. So then that's very easy to fix. Just start to add more vegetables to your meals. Now, studies have shown that there are certain types of vegetables that are cancer preventing. Vegetables like cruciferous vegetable. What are those? Broccoli, cauliflower, collard greens, cabbage, kale. These vegetables, they have what we call sulfurated phytochemicals. And these chemicals are anti-cancer forming. So if you want to protect yourself from cancer, you need to consume more leafy green vegetables, including broccoli and cauliflower, collard greens, kale. Now, vegetables that are high in vitamin A are also protective against cancer. Beets, carrots, tomatoes, eggplant. These are high in vitamin A, C, and other antioxidants, and these are anti-cancerous agent. Now, we can talk about whole grains. Now, whole grains are high in phytates. Phytates are believed to be anti-cancerous. So if you don't like brown rice or black rice or quinoa or rye, just ask your wife or yourself. Start adding these whole grains to your diet, and this will help to protect you from getting cancer, or if you have had prostate cancer, then from getting recurrent prostate cancer. Now, a diet that is high in animal products, red meat, processed meat, this will also put you at risk for getting cancer or recurrent cancer. Now, as a matter of fact, processed meat is processed meats are categorized as type 1 carcinogens. Do you know what carcinogens are? Carcinogens are cancer-producing agents. Saturated fats in these animal products are also will increase your risk for getting cancer. So there's so many things that you could add to your diet and things you need to reduce from your diet in order to protect yourself from prostate cancer. What about fruits? Now, a lack of fruits will also lead to prostate cancer or prostate cancer recurrence. So fruits that are high in vitamin C, fruits that are high in flavonoids, Fruit that are high in lemonoids and pectin, like berries. These are fruits that you need to consume on a daily basis. It is believed that at least 5 servings of fruits per day will decrease your cancer risk. 5 servings of vegetables a day will decrease your cancer risk. Fruits and vegetables are high in antioxidants. Antioxidants will neutralize the carcinogenic effect of free radicals and will protect your cells. Now, there are a lot of people who think beans are hard to consume because of the bloating. Beans and legumes, they're high in fiber. They're also high in anti-cancerous phytochemicals that will improve your health or protect you from getting prostate cancer. So beans like lentils, soybeans, black beans, red beans, all of these beans are very helpful in helping to fight against prostate cancer, breast cancer, colon cancer. Now, a study was done that showed that the consumption of cruciferous vegetables, folic acid, and whole grains will decrease the risk for colon cancer. Let's extrapolate that to prostate cancer, because nowadays we are seeing that a healthy nutrition, a plant-based diet, is effective in fighting many different cancer and chronic diseases. And then I'm sure you must have heard about exercise. Exercise is indeed medicine. So therefore, exercising for at least 30 minutes a day, vigorous exercise, will decrease your risk of obesity, decrease your risk of cancer formation. So I'm going to ask you just to get out there and walk. You can walk briskly for half an hour. I like to tell my patients to get up and walk early in the morning, because we need to make exercise a priority. Because if we don't exercise, if we don't start in the mornings, then with our busy lifestyle, then most times the patient forgets to exercise. So as you're listening to me, make sure that you're exercising every day. Make it part of your lifestyle. You know, if you were to make healthy lifestyle a habit, then a lot of these diseases we're seeing right now would not have. You know, you might ask, Dr. Cooper, so what do you have for breakfast in the morning? My breakfast is very simple, usually. Oatmeal or some whole grains, nuts and fruits, and soy milk or almond milk. That's breakfast. Lunch, I like to have a big salad, but that salad should have many different colored vegetables, leafy green vegetables, carrot, kale. I like to put beans and nuts. I forgot to mention that nuts are high in vitamin E. Vitamin E is an antioxidant. Antioxidants are essential for good cell health and to prevent cancer formation. Then in the evening, I do not like to have a big meal in the evening, because if you consume a big meal in the evening and if you don't have enough time to work off the calories, then that leads to weight gain. Weight gain leads to obesity. Obesity then leads to high insulin production, which leads to insulin growth factor. That is a cancer-forming element. So you want to make sure that you're eating at the right time, the right food, the right amount, and that you're maintaining a healthy weight. If you're listening to me and you don't know your BMI, the next time you go to your doctor, just ask your doctor to check your BMI. And if your BMI is, 30 and above, you're already obese. If the BMI is 25 to 29.9, you're overweight. So you need to work off that weight and keep the BMI closer to the normal. Because if you do so, you're going to prevent yourself from having multiple risk factors. You might be wondering, so where do I start? I don't know what to do. I have three books on the market right now. One is Get Healthy for Life. In that book, I outline 9 pillars of health, all the important health factors that will promote a long, happy life. Then my second book is 14 Days to Amazing Health. That gives you a kickstart to a healthy lifestyle. Men, if you're listening to me, buy those books. You read the books and give to your wives so that the home, everybody at home can start to live a happier and healthier lifestyle. Then the last book is Incredibly Delicious Vegan. When people hear about eating more fruits and vegetables, whole grains, nuts, and seeds, you're wondering, how is that going to taste? Where do I get my protein? Where do I get my healthy carbs? Well, if you purchase any of those books, you will understand how you can use plants as medicine, what to eat, how to make it delicious, and how you can change your life. Now, at this time, I'm going to let you look at a very simple recipe using soy. I mentioned that soybean, tofu can help with cancer suppression, especially prostate and breast. So let's look at this very simple video, and I want you to practice this at home. Welcome to Get Healthy with Dr. Cooper. The doctor is in the kitchen today, and I'm here to show you how you could use your food as medicine. And today with me I have Estela Garcia, a registered dietitian. Welcome, Estela.
Thank you, doctor.
What do you have for us today?
Today we're going to be making tofu fruity.
Tofu?
Yes.
So can you use tofu as a dessert?
Yes, this is very good. This is like your own yogurt, making it from tofu.
So what is tofu, by the way?
Well, it's soybean that has been coagulated, but it replaces your regular yogurt, has the protein.
Right, so it's bean curd and it's high in protein.
Yes.
Fantastic. Go ahead, Estela.
So this is very simple. All we need is a blender, so we're going to go ahead and add our ingredients. So we need a packet of tofu. This one, it's tofu, so we're going to go ahead and put it in here.
Should it be soft or medium soft?
Yeah, this one is the firm one.
Okay, firm tofu.
Mm-hmm. And then we're going to add the rest of our ingredients. So we're going to go ahead and add half a cup of juice. This is apple concentrate. This one is frozen, so I let it, a little bit
so it's
defrost.
from the concentrated juice.
Yes.
All right, what else do you have?
We're going to add half a lemon, so it's like a tablespoon of lemon juice.
Very good. And lemon juice is high in vitamin C. Very good. What else do we have?
We're going to go ahead and add a cup of frozen fruit. So I went ahead and used frozen strawberries and some frozen raspberries.
Right, and these berries are high in antioxidant.
Yes.
And so they're good for your heart and good to preserve health.
Yes.
And what else do we have?
We're going to go ahead and add the banana. This adds a little bit of its own sweetness.
Okay, so some natural sugar from the banana. Now, if you're diabetic, we still have to be careful with the amount of sugar that you consume. Very good. And of course, banana is also high in fiber and high in potassium, which is good to lower your blood pressure. What else do we have?
We're going to add a pinch of salt, just a little bit, okay?
Just a pinch, because remember, too much salt can increase blood pressure, so you have to be very careful with the salt intake. What else do we have?
That's it.
All
We're
right.
going to go ahead and blend it.
Very good.
We're going to have to stop
You're going to
it.
mix that up together to make it go a little easier. Very good. All right. Let's go. Looking good. Excellent.
Okay.
Looks pink and delicious.
Okay. All you do now, we're going to go ahead and set it up in our cup.
In a glass. Let's put it in this
So
glass.
we're going to go ahead and put some slice of bananas.
Alrighty. Let me get some bananas. Let's see. Okay, go ahead. Looking very delicious, Estela. What else are we going to add here?
And let's put so we're going to kind of like pile it up like our...
Okay. Let's put some more. There you go.
Very good. And then we're going to go ahead and put some granola.
It looks very, very delicious. Let's get some of this here. And of course, we do not have the cholesterol because we don't have the regular milk here. Very good. I think that's good enough.
Very delicious.
Very delicious. So for you out there, if you have a sweet tooth and you like to have dessert, then this is very healthy. You have tofu, that is made from bean, high in protein and high in fiber. And of course, we have the banana, your fruit. We have the berries,
yes, very
which
good.
are
Low in
great.
glycemics.
Very good. And of course, you can add any other dry fruits that you need.
Yeah, so this one can be used as a breakfast.
As a breakfast.
Or as a dessert, like a parfait. I was trying to do like a parfait.
So then we could put it in the refrigerator to get it cool and ready to go.
Yes, so it's going to be a good breakfast because you have everything that you need for your...
Fantastic. Estella, thank you so much for being on our show today. And if you want more recipe, go to my website, gethealthwithdrcooper.tv or cooperwellnesscenter.com and visit our site on Facebook. Thank you so much for watching. Thank you, Estella.
Thank you for having me.
Yes, that was a very simple recipe, very tasty. You notice we use tofu. We need blueberry, that I said that blueberries are high in powerful antioxidants. These antioxidants will neutralize carcinogens. So, and then we use the banana, that's natural sugar. Sugar, you need to stay away from processed sugar because cancer cells grow more in processed sugar. So if you really want to change life, you can send me messages, get the books, and you can start right there. Remember, I said that your genes load the gun, but the gun could be sitting there with many bullets. Your lifestyle pulls the trigger. So you can tweak your genes. You can keep those genes dormant if you live a healthy lifestyle. Now, if you do not live a healthy lifestyle, then you're placing yourself at risk for many diseases. Cancer can be prevented. So please take counsel. Share these videos with your friends. If you have loved ones, share this video and pass the message on. We're here to empower you, to give you knowledge so that you could use this knowledge to live a happier, longer, and healthy life. If you really want more information, then go and find my website. I have several sites, but the main site is drdonacooper.com. So go to that site and you can get all the information you need on how to live a happier, healthy, and longer life. And remember, God wants you to stay healthy. However, you're not forced. The choice is yours. You know, in 3 John 2, he said, "Beloved, above all, what I want you to have a good and happy and healthy life. But remember, you have the power to change your life. The doctor can only guide." So continue to follow me, and I'd like you to leave me questions. I didn't have time to look at the questions today, but leave me questions, leave me comments, and I will answer those questions in our next show. Remember, November is Men's Health Month. We're going to be looking at, testicular cancer and different problems that you might be experiencing. So call your friends. Tell them every Sunday, 6 o'clock Central, Dr. Cooper is on, and I will answer the questions. Let me see if I could find any interesting questions that I could answer before I close. Let's see what I have here. But in the meantime, keep sharing this information, and I'll get back to you. Excellent. Okay, let's see here. So call your friends. Tell them every Sunday, 6 o'clock. Should we be concerned about high lectin level in lentils? No. Lentils are high in fiber, high in protein. Lentils are good for your health. I mean, most are plant-based diet. Plants are here to heal. So should not be afraid. Now remember that in everything you do, you need to be moderate. Moderation is important. So if you overeat the healthy nutrients, you're going to have a problem. If water is good for you and you drink too much water, that could create a problem. So in everything you do, remember to exercise control, exercise moderation. All right? As I continue to read these questions, I will answer you after the show. Share this with everyone, and I'll see you again next week, same time, same place. Until then, enjoy good health.